Okay, so I'm here today with young Zoe, and you're 8 years old, nearly 8, huh? Okay, so I want to explain how airway can influence development of the jaw. And in this particular case, if you look at Zoe's x-ray, you can see massive adenoids and large tonsils, just on the x-ray. Look at the angle of the teeth. This is caused by a tongue thrust, right? Now, if you look at this x-ray, which shows me the space requirements, look how narrow the maxilla is, so there's no room for the canines, right? So what we're going to do is just explain what general dentists should be looking at, other than just crooked teeth, other than gums, the airway, which is what I'm very big on, because a lot of the children that I treat, I'm the one who's diagnosed that they have conditions such as sleep disordered breathing, which I'm pretty sure is what's going on here. I've spoken to mum already, and this young lady tends to sleep with her mouth open. She snores, and you'll see why when we have a look. But I want you to start asking the right questions. And one of the big things that I like people to do is to fill out one of these charts. It's called Healthy Start. And it asks the right questions about the kid's airway. It links it to the dental aspect of things. All right? If anyone wants a copy of this, send me an email. I'm more than happy to coach you through what to do, because it's really important that you as a dentist pick up the kids' airway problems. Zoe, if I give you some glasses, is that okay? You can put those on? Good girl? Yep. And then we're going to go for a little ride in the chair, just to pop the chair back. And then we're going to have a look at your mouth. So a couple of things that we look at here. You can see the hypermineralization of the enamel, and that's obviously there's desiccated teeth, right? We can also see, can you open really wide for me? Big R, can you open? Big R. Now you try and lift your tongue up, yeah? And we look under the tongue to see if there's a frenum restriction. Hers is pretty good, right? The next thing, bite together again. We look at what's called the swallowing pattern. Can you just swallow for me? Big swallow. Yeah. Can you see the tongue going forward? Swallow one more time again. There's the cause of your protrusive incisors. It's an anterior tongue thrust. Now, we measure the upper lip, and the upper lip length in a female patient would be, say, 25. She's got a very short upper lip, so it means that when this young lady smiles a lot, you're going to see a lot of gum, which is what we call VME, right? Now, open nice and wide for me, big R. Have a look at the tonsils there. These are what we call kissing tonsils, right? Just say R one more time. Good girl. And that shows the uvula and the tonsils all together locking the back of the airways. What we would call, one more time, please, Zoe. Good girl. Thank you. Big R. Wow, look at that. Big R. That's what we call grade 4 tonsils. It's a Mallampati of 4, which means that all that airway is obstructed. So if I don't fix the airway and I don't teach her how to keep her lips together and breathe through her nose, none of my orthodontics is really going to be successful. So it's my job now to explain to a mum why, even though they've come in with protrusive teeth, the protrusive teeth are because of the imbalance of the tongue. The tongue should be up on the palate. Now, can I open nice one? Have a look at how narrow the palate is. Big up. That's like a V-shaped palate with a high palatal vault, right? So we need to widen that palate, and that'll give us the room to bring the incisors back, yeah? The other thing we need to do is obviously work on getting the lip together and breathing through the nose. And that's going to be very hard for her with those large adenoids that I saw on the lateral cephalometric radiograph and the large tonsils I can see in the mouth, right? So think airway first and teeth last, right? Thanks very much, Zoe. You did really good there. All right, I'm going to pop the chair up.